Good afternoon and welcome to this month's High Reliability Organization webinar presented by the Virginia Hospital and Healthcare Association's Center for Healthcare Excellence and the Virginia Patient Safety Organization. My name is Abraham Stigris. I'm the Vice President for Quality and Patient Safety here at the VHHA, and hope everyone is having a great summer and finding a way to stay cool. On behalf of the VHHA Center for Healthcare Excellence and the PSO, I would like to welcome all of our colleagues from across the state to today's presentation and our ongoing monthly webinar series featuring successful strategies from Virginia hospitals and health systems promoting safety culture and high reliability. Today, I'm glad to present our colleagues from Chesapeake Regional Medical Center and their presentation entitled Pulsara, an app-based communication program that we use with our primary EMS agency, and this is used to enhance their response to stroke, to ST elevation myocardial infarctions, also known as STEMIs, and sepsis. Our presenter from Chesapeake Regional today is Alex Collins, their neurosciences coordinator. Next slide. A couple of housekeeping notes before we get started. The slides were sent to all the registrants this morning. This webinar is being recorded. We encourage you to use your telephone option if you'd like to ask questions at the end of the webinar. All participants are currently are muted at the current time. We also encourage you to submit written questions in the chat box on the webinar platform. We'll ask that all questions be saved to the end of the webinar, at which time we'll open it up to read questions that come in from the chat box, as well as take any questions over the phone. So at this time, it is my pleasure to turn the presentation over to Alex Collins, the Neurosciences Coordinator at Chesapeake Regional Medical Center. So Alex, you have control and you can move forward.
All right, thank you very much. All right, let me find my mouse. There it is. Hello, everybody. I hope you're having a good day. If you're in Virginia, hopefully you're not on the East Coast. It is sweltering. Anyway, okay, so I'm here to talk about Pulsara. Pulsara, as you can see here, is an app-based mobile program. It's just like any other app you have on your phone, okay? It utilizes smartphones, tablets, so you can either have them in your pocket, you can have them mounted at the CT station, or mounted at the ED charge nurse desk, wherever is convenient for you. Just make sure you don't lose them. It's coordinated communication for medical emergencies. So, as was mentioned earlier, here at Chesapeake, we use this for STEMI, stroke, and sepsis response. And I'm here to talk specifically about stroke. And I'll briefly touch on STEMI towards the end of it. This is, we got a little screenshot here of what it looks like. You can use it for whatever you would like to, as you see. We just chose to use it for STEMI, stroke, and sepsis. But as you can see, there's even a general tab here. And I'm sure EMS would prefer that rather than calling in all the time. They can just click that tab and use it for whatever. So we are trying to flesh this out, show them how successful we can be with the stroke, with the applications that we currently have, and maybe even carry it out even farther. But right now, some of the advantages are it's HIPAA compliant, so you can enter specific patient information into it without having to worry about violating HIPAA. It's in partnership with Chesapeake EMS and Currituck EMS, but we have the potential to expand it across the region. So we're trying to show how successful we can be with it in hopes that it'll be adopted even farther out, because it's an excellent communication tool. And as you can see, there's some more screenshots of it. You can actually plug the patient's name right in here. I don't know if you can see my mouse moving across, and I'm attempting to underline it there. Date of birth, you can see that doesn't have to be entered, but it can. We can say whether it's inpatient right here, but it could also be EMS. It could also be an ED triage patient, what room they're in, and then down here you see team alerts, and that's how many people on our teams are involved, and that'll get, I'll flesh that a little bit more as we go. If you look over here on the right side of that slide, you'll see the last known well date. You'll see the RACE score, which is a stroke score that the EMS have been trained to use. It helps identify large vessel occlusions, among other things. Okay, talks about anticoagulation. because if that patient is on warfarin or Eliquis or Xarelto, that could be problematic for TPA administration, but maybe not for intervention. And we'll get to more, and you can see the blood glucose level right here. Oh, one more thing. If you look down at the bottom here, okay, where it says last known well and first contact, the last known well obviously is ridiculously out of the window, but that is an ongoing clock that's running, and you can see where you are. Everybody can. Everybody who's on sees when the last known well is, so it keeps people paced. First contact will show when they arrived, when somebody came into contact with them. Okay, so let's get into this. This is how we use it at Chesapeake Regional. There'll be a video at the end, which is really quick, but that shows how other people might use it, other facilities might use it as well. So here we are, stroke. This is an EMS presentation, but it could easily be an ED or a inpatient. So here we go, the action. EMS enters the patient information into Pulsara. Now, that patient information has to be a minimum of name, okay, has to have last known well, has to have blood glucose, things like that, okay? ETA is also included, but it's not manually entered. It's automatically calculated by GPS so that the receiving facility will have an accurate estimate of when that patient is going to arrive. The following people are notified. As soon as that EMS patient hits activate, the ED charge nurse and Chesapeake Regional has a standalone stroke team, RRT team, so that's included there. So the ED charge, the stroke nurse, and CT are activated, okay? So all at the same time, we are immediately made aware. And the benefit of that, if you look to the right there, is that information gets sent to everyone who needs it at the same instant, okay? This streamlines communication. First of all, enable CT to determine if they can squeeze some more people onto their scanners before the stroke patient gets there, or if they need to make immediate availability. So it lets everybody else perform their jobs more efficiently, all while preparing for the stroke patient to arrive. All with this one single swipe of a button on the Pulsara application. Now, as that patient is on their way to the hospital, the EMS medic can then update new labs or also include changes in the patient condition. They're worsening, they're improving. Hey, the person is an AFib. We were unaware of that before. Things like that. And the ED charge nurse and the stroke nurse will receive those updates in real time. Okay? And again, a benefit of that is the patient data is located in a single, easy to find location. So we can reference it really quickly without having to go into Epic or whatever other charting you have. You've got an app that has that data on hand. Okay? Next slide is the process when the patient arrives at the hospital. Okay, so EMS brings the patient straight to what we call the charge bubble. That's merely a central location within the ED where that patient can be evaluated. Now, as that patient arrives, the ED charge nurse enters a door time into the Pulsara application. Now, when that happens, CT is made aware, and the stroke team, who's already waiting there, by the way, but they also get alerted. The benefit to CT is now they know exactly what to do. They know where they are on the timeline, and then they will send information back to, they'll send it just through the app, we have 3 CT rooms, come to CT1, because that's the bed that's available. All right there. We don't need to make a phone call. It just comes right in over the app immediately. All right, now, as that's happening, the stroke nurse and the doctor are assessing the patient. All right, the stroke nurse enters the NIH score, which is the stroke score, into the Pulsara app, thereby notifying everybody of that score, okay? Now, from there, the stroke nurse and a representative from the ED, usually a tech, take the patient to CT, okay? And now here's where the next part is. If you look over here under the benefits side right here, you see that we have teleneurology. Well, teleneurology has already been activated by the ED charge nurse as the stroke nurse is taking the patient to CT. Well, the teleneurologist doesn't want to come on the screen yet because we're not back. All right. So what we do over here, you'll see when the imaging is complete, we're able to select that in the Pulsara app that alerts the teleneurologist. Now the teleneurologist knows that he or she has about 6 minutes before we'll be back in the emergency room and ready to be evaluated. Therefore, that teleneurologist is also able to prioritize his or her time and not sit on the screen for 15 minutes, because we can also, sometimes there are situations that come up, there are complications. We can key that, we can key that into Pulsara also, but meanwhile, the teleneurologist isn't sitting there twiddling his thumbs waiting for us to get there, okay? Now, the patient is returned to the ED for the teleneurology assessment, and that teleneurologist pops on screen. Okay, now, if a large vessel occlusion is suspected, so the teleneurologist will then assess the patient with the assistance of the stroke team, and then he will also look at the imaging. So if it's determined that this stroke is severe and a suspected large vessel occlusion is present, he will call the interventional neurologist. That interventional neurologist will then look at the films with the teleneurologist, and if he agrees also that the large vessel occlusion is present and the potential surgical intervention needs to take place, all he has to do to activate his team is swipe suspected LVO into Pulsara. Okay, and that will send an alert out to another group of people. That group of people is going to be his interventional radiology team. It's also going to be anesthesia, and it's going to be people up to that point who did not need to be aware. Okay, so they up to this point, they're unconcerned with anything. They don't know anything's happening. But now that that gets swiped, they know that there are times on the clock, and they can get in. They can then come on into the hospital. So again, the benefits: the intervention team gets activated by a single click. Now we're not calling 3 and 4 people. We're not texting 3 and 4 or however many people are involved. One swipe sends that message out to everyone. Now, another thing: everyone who is already activated. Okay, that means the charge nurse. Okay, that means the CT tech. That means anybody else that's been involved. They also get that alert and see, oh my gosh, that was they're really heading out there. Okay, they're going to intervention. Okay, now before we look at this video, I want to say a couple other things. Pulsara allows you to customize the app. Obviously not 100%, but you can do it so that it fits your facility. So some of the things I've described, you're not going to see exactly that same thing when we look up here at the video that's going to come by. But it will, what I've said prior to that will allow you to kind of make connections and see how you could adapt it to fit your facility. Okay, I'm going to go and start the video. All right, see if we can play it. I'm going to start it over here. And let's see here. Hoping for the best here. As you can see, as soon as the video starts, I'll stop talking. But as you can see over here on the left, you've got the EMS medic, and that's just a title you can change. You got the charge nurse, which is the ED charge. Let me try playing one more time here. Anybody here? I can't hear anything. I don't see it happening. I can't hear anything. I can't hear anything. I can see what's going on, but I don't hear anything. Anybody else there? Teresa, are you
here? We're here. It doesn't appear that the audio is being projected for the audience. So you may have to provide the narration video.
Okay, I'll do the best I can. All right, here we go. All right, here we go. All right, everybody, sorry about that. I'm going to expand this again and then take this off. Well, maybe I am. Do I have control? Oh, there we go. It's just kind of delayed. All right, I'm going to bring it back. Maybe. There we go. Just a little bit of delay. All right, we'll do it here, and I'll hit play. Okay, so basically you see here, that's where the medic is going to come in. So the medic arrives at the patient, and then we'll hit new. See that? And they're going to choose one of these. They choose stroke, and then they pick what facility they're going to go to, because sometimes they have multiple facilities. So you can see where they're adding the patient, time at the patient, they enter the height, the weight. You see some other things they can enter as they go along, okay? They can take a picture of the patient and include that in the, you can include that in the app. So that then the charge nurse can then open those images and look, okay? Then he has the race score there, where you see they score the patient, and then they hit alert. Now you see who gets notified. That charge nurse sees that as the very second that the EMS patient says go. And you can see those highlighted images and contacts in there. They can open those images up. They can see the patient's, like you saw the droopy mouth. You can see the patient's ID and the medicine list. EMS can do all that. Now you see when the charge nurse activated, the neurologist and the radiology tech were alerted. Okay? Now, there is a ton of stuff you can do in this, okay? But you can use as much as you want. Now I'm going to pause it here. You see how they opened up that team alert that I talked about earlier? You may not remember, but it was a while back. You open that up, there's a phone here. If you click the phone, it will actually call that person within the app. So you have direct communication with other people in the team inside the app. You no longer have to go outside of your phone, find your contacts, click the person, give them a call. You can call the person immediately. And there's also the excuse me. There's also the option to video chat. I don't see it here, but sometimes there's a video image here. You can click on that icon, and you can have a video conference with the EMS individual, with the stroke team. So all kinds of options are in here. All right, I'm going to click play again. Okay, there's that NIH. You see that? They can enter that. You see the running time down here. So now the patient's at the door. See how they put the door time in? And everybody on that list then gets notified. Now you see EMS doesn't get notified. EMS will get notified at the end, but they don't need to be aware of everything in the middle. Now you see the imaging's complete, like I was telling you before. Now you see who got notified there. I'm going to back it up just a bit. Okay, so the radiology tech then said the CT is completed. Now you see the neurologist got that notification and the charge nurse got that notification at the same time. So you're not calling 2 or 3 people. You are activating it once. I'm going to keep it playing. Okay. And then you see they can click different things in here. All right. Again, once something gets notified, everybody's made aware. Now the neurologist is involved. See, it's on his screen or her screen. You can see that door time right there. So all this is taking place. We're on the clock here. We want to make sure that we're getting this efficiently done. If you look down here at the lower right-hand corner, see that's a text box. Okay. So you can send an image. I'm going to back it up just a little bit and pause it there. Let me back it up a little bit more. Okay. Now, see, you've got contraindications. If there are, you've got them. Okay. You can see you've given TPA right here. If it's a suspected LVO, they click that and they get a drop-down box. Okay, you see them where they're clicking stuff and that pops up. You can do your NIH there, your contraindications. Okay, they can set the time where they gave TPA and see how everybody's notified of that at the same time. And then you've got, see that? The suspected LVO, boom. Now, charge nurse and RT and the IR team members, see that's the interventional radiology team members. And that can be, that's not just one person, that can be several people. They get alerted. So now they understand that they have to come in and provide potential intervention for this patient. Okay, you can see they activated the team. Okay. And then they could say where they're ready. IR is ready, they swipe it over. Now they get notified. And again, you can use as much of this as you want. See, reperfusion, TK2B, and then stop. Okay, now, when they hit stop, even EMS gets notified, so you give EMS immediate feedback in real time of how well or of what happened to the patient. And EMS, if you've ever had the opportunity to sit in the ED as you're taking care of a patient, EMS wants to know, hey, how are they doing? You know, because they got them in here really quick, and they really, really appreciate that feedback. Okay, so I continue to play here. See what else we've got going. Okay, I think that might be it. So I'm going to go ahead and minimize that. We'll go ahead and stop this. Now it's, you know, talks about more Pulsara stuff. So I'm going to minimize the screen. We'll go back to the deck. Okay, so that basically gives you an overview of what it looks like for stroke. And again, that's how we utilize it. Okay, there's ways that you can adjust it to fit your facility, and you can also do it for STEMI. The representative was supposed to handle STEMI. He unfortunately got called into staff today, so he was unable to do it. But this gives you some other, if you look at these three screens here, 1, 2, and 3, they look very similar to how they did in stroke, but they're a little bit different to greater fit STEMI's needs. Okay, but the process the effect is the same. It's still a communication tool. Now, and again, this is very brief. I was going to put more into it, but I'm not the STEMI guy. He was going to come in and add some more. But EMS activates STEMI the same way it does with stroke. The ED charge nurse is notified, CT is notified, rather CAT team is notified. And the EKG can even be sent through Pulsara. Now, I know there's some other methods that most hospitals have that allow that EKG to be transmitted, you know, from EMS to the ED. But the fact that Pulsara allows you to do it too is a handy tool. Okay, Pulsara's advantages. Effective, efficient communication. A group is only activated when their role in the stroke process is required. That means they're not getting hit with alerts that just make you alert numb. Okay? So, for example, the anesthesiologist doesn't need to be aware of a positive stroke. They only need to be made aware if they're going to do surgery, which is way down the line. So only those people that need to know are alerted. And as that progresses, more and more people can be alerted. Now, once activated, everybody is in on the loop of what's going on with that patient. Questions regarding patient status can be sent through Pulsara at any time. They have that little text box I was showing you at the bottom. You can say, hey, I've been delayed at CT because the IV blew. We need to put a new one in, or something like that. Okay? You can even have live calling within the app. You can even video call, which is very handy. You can say, hey, listen, here's the patient situation. I can even show you what they look like. Boom. And it's HIPAA compliant. The hospital is able to give EMS immediate feedback in real time, which they really, really appreciate. Okay? And that's it. I hope I didn't run too long. I know it's almost 1 o'clock. Does anybody have any questions?
Alec, that was wonderful. Very good timing, very good narration of the video. Excellent job. So we're going to take back control of the webinar, look and see if we have any questions online. If anyone wants to ask a question, you can go ahead and raise your hand using that function in the webinar platform. And as we check for any questions, Alec, you may have referenced this, but can you talk about what, if any, interfaces you all have with your EHR using this app?
I believe we don't use any because there's several different ones that they've chosen to utilize, and we don't have those. I think Rapid is a form of it's a form of CT imaging technology, and I believe that interfaces, but we don't have that, so we're unable to use it. So I know it has some interfacing, but we're not able to utilize it at this point, but hopefully in the future.
Okay, perfect. We're checking the chat box, and I don't see any questions yet from our participants, but your presentation was so comprehensive and thorough. I think most of the questions that folks would have anticipated you likely covered. So I do see there's like one question popped in there. Do you all have any results yet comparing the use of this product versus not using this product? Any preliminary data on that or results, Alec?
Well, not yet, because we've just started. I say just started. We started it back in January, and it's been we're working towards even fleshing it out even further. We have had the problems that happen initially is stroke is and STEMI and sepsis, while they do occur quite a bit, EMS is forced to use the app and like for stroke, but then they have to use, like, let's say there's a GI bleed or something, they have to call that one in. So some of the roadblocks we have are the fact that EMS is having to use 2 different ways to alert the ED of patients coming in. But we're trying to show that, that we can utilize this in such a way that maybe they can just use Pulsara instead of 2 different ways. So
gotcha.
We have gotten positive feedback, especially from EMS with our feedback tool. Okay, with our feedback tool. And as we go forward, we've also gotten a little bit of positive feedback on how it eliminates the need for excessive phone calls. Because often when you try to call CT, inevitably they're not answering. And of course they say the same thing about the nurses too. So, but that communication is right there in the app, and it kind of cuts back on those on the phone calls you need to make intra-hospitally, if that makes sense. I think I made that word up. But those are some of the things we've gotten positive feedback on. But as far as the raw data that you're asking for, unfortunately, I do not have that.
Okay. Well, we certainly appreciate you guys agreeing to share this, even though you're fairly new in the implementation. So this might be one we want to sort of put a bookmark on and come back at some point in the future to see sort of what additional feedback you get in addition to the positive feedback you've already gotten about the enhancement of communication.
And one more thing, this is they haven't adopted it yet, but the Tidewater EMS system, because the Hampton Roads has several different cities, several different hospitals. You have different cities transferring patients to hospitals that are outside of their city. So we're trying to find a way to kind of streamline communication across the cities. And this is something they're looking at. They have not agreed to adopt it yet, but we are looking at it as a potential tool for that.
Well, that's good to hear. Sounds like you guys might be the leader in pulling your area together in that regard. So, again, Alec, we don't see any more questions popping through through our chat box, and we're at 12:58, and so looks like we were able to give folks an excellent presentation today and give them 2 minutes back in their afternoon schedule. So. Many thanks to you and your colleagues at Chesapeake for sharing with us. Thanks to everyone across the state who was able to join in for the webinar this afternoon. We hope that you all enjoy the rest of your summer, and we look forward to seeing you next month, 4th Monday, 12:30, and we'll have our next webinar series. Again, everyone have a great summer and stay cool. Thanks very much.
Thank you so much.
All right. Bye-bye.
Bye-bye.